So I'm Andrea Edwards, a computer science faculty member at Xavier University of Louisiana, and we're here to talk about our research in using data to affect health disparities in minority communities.
I'm Elise Jones. I'm a senior public health major.
I'm Joaquin Mitchell. I'm a senior computer science major.
I'm Caden Ireland. I'm a senior computer science major. So here's our abstract. So COVID has been disproportionately affecting the health of minority communities all across the United States. There is data on social determinants of health, but sadly, this information is not always accessible to the people who need it most. Using Amazon Web Services QuickSight, we prepared a few visualizations to highlight health disparities. We actually found over 100 megabytes of data from publicly available U.S. government data sets. We filtered the data to two counties, Orleans Parish in Louisiana and Fairfax County in Virginia. So we picked Orleans Parish because it has a high minority population and is the home of Xavier University of Louisiana. And we picked Fairfax County because it's the home of Net Impact Strategies Incorporated, the company that actually supported our access to the Amazon Web Services software.
The first in the top three graphs is population. In the darker blue, you will see that is Orleans Parish, and in the lighter blue, you will see that is Fairfax County. Orleans Parish is very much smaller. In the next graph, you will see the difficulty paying for household expenses, and you'll see in the lighter blue, Orleans Parish has much more difficulty versus Virginia Fairfax County in paying for these household expenses. And the last and final graph is health without health insurance for ages up.
In examining the data shown on race across populations at the bottom left, the fact that Fairfax County has a higher amount of white people proportionally than in Orleans Parish, which is shown in green, while Orleans Parish has more Black people than in Fairfax County proportionally, which is shown in dark blue. Um, this information can be used to account for the difference in the risk factors for COVID-19 in the two counties, which are shown on the right. A lot more people in Orleans Parish have three or more risk factors than in Fairfax County, which is shown in orange, while Fairfax County has a higher percentage of people with zero risk factors for COVID than in Orleans Parish, which is shown in the light blue. When applying the socio-ecological model to this information, it can be seen that multiple variables affect the amount of risk factors impacting the racial groups in each county. These variables involve how an individual interacts with their environment and vice versa. They include individual, interpersonal, community, cultural, and policy-related interactions.
So here's our slide on educational attainment and health disparities in relation to COVID. So obviously us being college students, we were interested in how educational attainment may affect health disparities. And our hypothesis is that educational attainment would greatly affect access to COVID resources.
In examining the available data shown on educational attainment in Orleans Parish and Fairfax County, the top blue line that's light blue is showing us that those 25 up in Orleans Parish have a lower rate of having a bachelor's degree than those of the same demographic in Fairfax County. When comparing this data to the COVID-19 rates in each respective county, Fairfax County has a lower rate of positive cases than in Orleans Parish. We applied the health belief model to this information and found that those with a higher educational attainment level have higher perceived susceptibility and severity in regards to COVID-19. This data allows us to come to the conclusion that knowledge helps in understanding risk perception, and it has a significant relation to behavioral change, accounting for the significant difference in positive cases in the two counties we address. The individuals getting resources are impacted by this data because the lack of education in regards to understanding the severity of the virus restricts their means of using the resources available to prevent risk. In conclusion, Orleans Parish has more risks than Fairfax County, and these risk factors can contribute to higher infection rates. The health belief model and socio-ecological model suggests improvements to susceptibility, benefits, community, and public policy.
Orleans Parish residents are getting vaccinated, but there seems to be an issue with access to the vaccine versus hesitancy.
And like Joaquin said, as we can see, there are big differences between the mostly Black Orleans Parish and the mostly white Fairfax County. And there are ways that we can fix this, promote a more just and humane society.